The spinal erectors are the group of muscles that run along the length of the spinal column. It starts from the base of the skull and runs to the top of the back of the hips. When this muscle tightens up, it's possible that it could further accentuate both lordotic curves here and here, and then also cause a further accentuation of the kyphotic curve here, which usually leads to this posture here. So you got a little bit more of that forward head posture, the anterior pelvic tilt, and then you get your hyperkyphosis. We're going to go over some different techniques that we can do to release the spinal erectors. The first technique that we're going to utilize is the peanut or Gemini roller. This is doing two things. We're mobilizing each spinal segment individually, and we're also working to relieve tension along the spinal erectors. What you're going to do with it is you're going to place it along the spine, starting right above the hips. Then all you're doing is you're laying back and relaxing onto it. It'll be uncomfortable at first, but as time goes on, that your pain levels are either going to decrease and go away, or it's going to decrease and then it will plateau. Once you either plateau or the pain goes away, you're going to take the peanut roller, and you're going to roll it up to the next spinal segment and then relax over it again. This is a very subjective treatment because we're going based off of our pain levels. Essentially, what we're doing is as we relax over one area, it's going to be painful, 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 and then as the spinal segment starts to give and some movement comes back and is restored to the area, that pain is going to either plateau or it's going to go away. So this is a very useful tool for relieving back stiffness. Once we're done restoring motion to the spine, we want to use that motion. So we're going to perform cat-cows, which is a yoga move. So what you're going to be doing for cat-cows is you're going to make sure that the knees are underneath the hips and the hands are underneath the shoulders. And what you're going to do is you're going to breathe in, you're going to tilt the tailbone up towards the ceiling, and you're going to look up towards the ceiling, and then you'll breathe out, and you're going to tuck the tailbone down to the floor and bring the chin to the chest. You're going to alternate. You can do this for about 2 minutes. And we're just timing it with the breathing. Other things that you can cue yourself to do is when you come up and breathe in, squeeze the shoulder blades together. And then when you breathe out, push the shoulder blades apart to really round out the spine. By doing this, we're trying to increase more motion within the spine after we're done restoring it using the peanut roller. Now that we've restored some of the mobility back to the spine, we want to stretch it out. And for this, we're going to perform a child's pose, which is another yoga position. So what we're going to do is we're going to separate our knees as wide as the mat and bring the big toes together to touch. We're then going to stretch the arms out overhead and bring the hips back onto our heels, or stretch them back towards the heels until you feel a nice stretch along the low back. We're then going to try and touch our forehead to the mat, which will help increase the intensity of the stretch. And we can do this for 2 minutes time to make sure that we get an adequate stretch. You can also just do this stretch for anywhere from 30 to 60 seconds.